When multiple providers are performing infant CPR, their positioning and chest compression method differ from those used for an adult or child. Francis, Jeff, and I will show you these differences. I'm going to provide chest compression, so I need to be at the infant's feet.
Since I'm going to be providing ventilations, I'll stand at the infant's side, and Jeff will stand at the infant's head to maintain the airway.
With multiple providers, compressions are delivered using the encircling thumbs technique. For this technique, place both thumbs side by side on the center of the infant's chest just below the nipple line. Then use the other fingers to encircle the infant's chest toward the back, providing support. Using both thumbs at the same time, compress the chest about 1.5 inches at a rate of at least 100, but no more than 120 compressions per minute. Let the chest return to its normal position after each compression.
Jeff will seal the mask while using the EC technique, while opening the airway using 2 hands. The BVM should be appropriately sized for the infant to ensure an adequate seal.
Since we have multiple providers caring for an infant, we need to change the compression to ventilation ratio to 15 to 2. That is 15 compressions to 2 ventilations. You guys ready?
Ready.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15.
Switch positions about every 2 minutes. The compressor calls for a position change by saying switch in place of the number 1 in the compression cycle.
14, 15. Switch and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15.
As with any patient in cardiac arrest, if an infant shows an obvious sign of life, stop CPR and monitor the airway, breathing, and pulse.
1 and 2 and 3 and 4 and